Hi, welcome to a new video with New Arch by Dr. Sal. Right next to me is Dr. John Halpern. He's my dear friend. I have known him for many years and always enjoyed seeing him when he came to visit me, and always had these wonderful conversations. And we've exchanged what's going on in our lives and our professional lives. And I've always felt that he understood our work. So I have been meeting with my team with patients who are candidates for rehabilitative full arch dental implant services. And oftentimes we keep quiet and listen to their stories, because that it really enabled us, it allowed us to understand them better. And I wanted to have a conversation with Dr. Halpern about what it really is, what it really means to have a functioning smile and ability to chew. What does it mean for a human being? What does this really mean? So I'm going to ask Dr. Halpern. John, would you please introduce yourself?
Hi, so I'm John Halpern. I'm a board-certified psychiatrist practicing in Massachusetts. I've held a professorship at Harvard for almost 20 years, and I left to run a new hospital that opened up in Massachusetts, and eventually just went back to private practice and some other things. And I'm also the president of the American Association for Social Psychiatry, very active then in organized medicine as well. And just delighted to participate in this because, it's not just a smile. Dental work should never have been carved away from the rest of, medical insurance to begin with, because it's part of our body. It's just a strange thing that this specialty, which requires its own special training, that shouldn't have created in our society this concept that somehow what we do to maintain our teeth is less important than everything else. And it isn't. So coming here, what I noticed right away with you, because, we all have to find a dentist, please, 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 please. It's the energy. Well, let's have somebody put their fingers into your mouth and they're actually not happy people, and have some things that are really, running smoothly. And that's something I've just always experienced here. Everybody has my own spouse, who's terrified of just dental work. After her first experience, she was just beaming happy, and she felt understood. So it's not just enough that for patients to get, what you do here. It's that feeling that you're going to meet them where they're at and give them confidence that you actually do know what's going to happen for them. And I think all of the photos that you always maintain of other patients, it reassures the scared patient. And 100% of people will be scared if they've been avoiding the dentist, pretty much. They might not say that they are, right? But there's always something behind it. It can't just be that, oh, well, I was just busy, right? And so there's a lot of things caught up with your work, and it does overlap with psychiatry quite a bit. Mm-hmm. And just like in my world, that people don't speak enough about it. Mm-hmm. I think this aspect of getting good dental hygiene going and maintaining good care, and then yes, of course, getting reconstructive work when you need it, can be life changing, can be life transformative. Mm-hmm. And people here, you get it, and I think you get good energy from it. So I would teach medical students at Harvard. I'd say, many doctors, few healers. Which one are you? Well, most of them will say doctor. Some will say healer. And then I'd say, well, you got that wrong. Oh, they're all upset. And they're like, well, what do you mean you got it wrong? And I said, well, the ambition should be both doctor and healer. But you told us to pick. I said, right. I set this up so that you would probably make the wrong answer. I need you to transcend the dumb question being asked of you, to see that the question is faulty, and that you always put the patient first. So I'm really looking for the fact that the ambition should be to be both doctor and healer. And that is what happens here. That's why these factors, you don't get paid anything more to see people walk out with with an extra beat in their step, that they really were treated with respect. And, they're getting more than what they even thought was possible often. But you make sure that they enjoy what's happened. And that's being doctor and healer, because person has to become used to the fact that just as how they're guarding a mouth that embarrasses them or humiliates them, they're maybe not quite prepared for what it's like to finally be free. And I think that, like a lot of these photos on your office wall, it's almost looking like a prisoner who's been set free. And the smile of freedom. That's what happens when this type of reconstructive work is done. So in my perspective, I mentioned this earlier before we started filming, I don't think that this really is cosmetic work. It's reconstructive work. I understand the insurance, people may say, oh, you didn't have to spend this much. You didn't have to do it this way. But regaining the ability to have normal facial expressions where you're not guarding it is essential for accurate communication. And most people aren't going to think about it quite as much as people like me or people like you. That's our job. Mm-hmm. But they're just to enjoy their life again. And so seeing somebody saying, I can smile again, they don't have to think through what all the ways that will impact them. Mm-hmm. But we know that. And for people that are on the fence about it, I think having a film like this is really important. Why should somebody have to suffer any longer when actually there is something they can do about it? And it's not to humiliate them anymore. It's actually to help set you free. So all these roadblocks, we have to deconstruct that and make it easier and easier and easier for people to come in. Whatever they did in the past, we all make mistakes, but we can change it. And this is what this represents. This is a symbolism of healing also with reconstructive work to your teeth, much more than you would imagine. And as I explained, it's hardwired, right?
Exactly. Yeah, exactly. I see that. So I've been in dental practice over 20 years, and it's amazing that I'm listening to you and I'm going back in time about my process of how I started to communicate, really understand others better, because it's a process for a dentist too. In the dental school, you're only taught how to do things. I mean, you're told to be nice to the patient, right? I mean, depends on your personality, if you're patient enough, but there's so much more than that about real communication, or really, the people understand. If they feel that they're being cared for, they feel that,
Well, just the power of touch, right?
Exactly, yeah.
We don't normally people don't touch us, and putting their fingers, strangers' fingers in your mouth, it automatically creates an affinity, a closeness. When I say that something is hardwired, I mean that we're pre-programmed without even thinking to react to our facial expressions of others and ourselves. That's what I mean by hardwired, just to go back. And here you are touching somebody's mouth, touching them, and you're engaging with them. A healer is going to notice that that's so low-hanging fruit. Why would we avoid helping a patient feel a little bit more comfortable? After enough time, you can tell they're tense. Everybody knows if you're really going to the dentist, right? If you're gripping your seat really tightly, I'm fine. This man's going to say, hold on a second. Hold on. No. You don't have to be afraid. Now, somebody else might say, well, this is what we're going to do next. You don't need to be so stressed. So you're going to be complained about for having your anxiety, rather than let's just go back a step. Why are you like that? And you will take time with people to help unravel that, and then let's proceed. So it's not enough for you, I think, to just do the work and to do it amazingly well. And I mean, see his work. It's amazing. That's not enough. You want them to feel good about it too. And a process where somebody is scared, even if you're doing great work. I know a lot of dentists say, well, look at the work that I did. He'll come back because the work is... There's people who don't come back for what they need to finish up even. And why did that? And that's with great work done. Why? It's because of those moments. And so you can't bill for it. But if you really want to be a healer, you have to meet people where they're at and help them feel safe about it. And explain what the risks are and not. This is what we're going to do. I mean, some things are practical, but no amount of reading on the internet or reading in a book about dental work and what happens is sufficient to understand the clinical experience of a seasoned provider. So we can read all we want and become an expert reading on paper what you do. Oh, you're the one who's licensed. But there's no book that will help approximate your clinical acumen, your clinical capacity I've seen thousands of patients now, and I know what I'm doing with this. That is missing as everybody becomes more and more expert researching things. I think anybody who's competent like you welcomes people who are well researched, because then the questions of you become more specific. And some people instead think like you're going to be defensive that I've read all of this, but not somebody like you. You're comfortable with it. That's a great question. Nobody's ever asked me that question. Here, let me show you that. And you actually stop and slow down and do that. And that's what makes for a great smile, is that look what is possible when you try to be wholly engaged with the person. And everybody, your staff, everybody does this, makes people feel like a whole person. And that represents what happens again when you get your mouth back.
Absolutely. And then what I've discovered, John, in my journey, in my professional journey, is that, I had, for a long time, I have treated a mix of, patients who were, they were not so hopeless about their situation. They had some problems, and exactly just like you beautifully have explained, they have, they felt the comfort, and we made a connection, and we went forward helping them. The type of population we're meeting now, who are candidates for the full arch, it's known as all on 4, all on 6. This type of treatment, many patients have lost hope because they have either avoided due to pain or negative experience, or gum disease, like severe gum disease, other problems, but they just don't have any more way to go. And then many of these folks, for a long time, and this might be years, they will think, or they will digest this. Some of them will try to see if there's another solution for them, and then at some point they understand they can't go any further, and that's when we meet them, or we will meet them in their journey of seeking their condition. Like, what is my condition right now? What is in there for me? Like, what can I do for myself? And so there's different stops until there's a point where we meet, and then they explain to us. Now, the biggest thing that we see is shame. They're very ashamed and afraid of being judged. So, we make sure that they don't feel that way, and they feel perfectly comfortable. And we try to give them options as well, because sometimes there are options. This is certainly a technical issue, but this is what we have discovered. So people, and oftentimes they come in with they hear things. There's a lot of information on the internet. So they look up all on 4, all on 6, implants on teeth. So they have some idea of, many of them, some idea of what this would fit. But that's maybe a positive thing, because somewhat, they are informed. But at the same time, I feel that it's a negative thing, because it became more of a commodity. But you cannot treat a human being. You cannot see a medical procedure as a commodity. It's wrong, whatever it is. Even if it's the best thing, I think it shouldn't be a commodity, because it's always patient specific, like you explained. It's something that has to be special to that individual person. And so that's the other part of it.
The nature of the internet,
right?
As a source, there's inaccuracies on the internet, and let's face it, how many people are really going to post on Reddit and elsewhere about how wonderful a procedure was, and it's all a home run? You go online, you just find again and again and again this skewed perspective of every complainer under the sun. And so again, that's not the correct clinical experience that we actually see. And so that's one way that it becomes ill-informed and may, in fact, contribute to a person hesitating. And I talk about the power of getting a reconstruction like that. I have a patient who's who's down in Fall River, so it's a little bit far from here. And so he went to see somebody he's getting a full upper and lower.
Implants, yeah.
How interesting. He's a salesman, and he had his teeth needed this work. And he's so talented as a salesman, he's still getting sales, even though he's guarding his mouth. Okay? He came for an appointment, and he's waiting for the, he's had his teeth removed, he's had some of the screws put in, he's waiting for it to heal for that next step. And he comes in. So he's in transition like this. I couldn't believe this. He's dating 2 women. I said, what are you dating? You're waiting for your teeth.
I guess.
And he goes, Yeah, but I did something about it, and I'm so excited.
He's ahead of the game.
I'm like, but you could wait a couple of weeks. He said, no, but he said the ones that just, it made me sick seeing what was so bad in my mouth. Just even getting that out, I feel like I'm already 80% there, and I see the teeth that I'm going to get. Now that's rare, something like this. But
that must have been the barrier in that individual, in that gentleman.
Yeah.
That, he knew that it was bad, and he's done something about it, and he's running with it. So that's awesome. I think that's not everybody's like that, but I think that's exactly the mindset.
And it's the energy then.
Right.
That when you feel that they've made a change in your life in that right direction, then sometimes you might be surprised what you're able to do again.
Say it again, please. I want to hear that again. I love that.
When you make that step in the right direction, it gives you hope.
Yeah.
It gives you hope. And then things can become possible again. Just like you assumed. There's no way that I can deal with what's going on in my mouth. Every year, every month, it's just slowly getting worse and worse and worse. That you imagine that to make it better will take forever. Do you see that? So a person's problem in the mouth is chronic over time, and you psychologically wind up believing that somehow the solution will be the same. And in fact, it can be transformatively changed for the better.
So there could be a problem. You're saying there could be a problem like in the mouth, but the ramification of that would be much bigger in our mind. Is that what you're saying?
Yeah.
Yeah.
Yeah. And so we tell ourselves things. It doesn't make them true, but we get used to telling ourselves things. And until an expert like you or me, whatever, say, no, wait, let me give you some more facts and let that digest. Then you have new information, you make a new judgment. But as long as you're not dealing with a professional with this problem, you're going to tell yourself whatever you find on the internet, whatever you think when you're looking in the mirror, whatever you assume, the nasty feedback that you got from somebody or somebody embarrassed you. And you think, okay, see, I know what's going on in here. And we can swat it away pretty fast with, no, actually, we can make a difference. And you see it again and again. Wait, you mean you can help me, right?
Yeah.
It happens all the time that they're surprised. And the reason that they're surprised is patients have conditioned themselves to believe that there is not only is there no solution possible, but if there is, it's a process as long as the process that it took to make their teeth bad. And that's just 100% not true.
Thank you for setting it so beautifully, but so that also explains what I, as a dentist, get out of this. I get some amazing satisfaction. So like satisfaction life is about satisfaction, right? So when you feel satisfied, you want to do more of it. So that's exactly what I feel. And this is why we make these videos, because we really believe in it. We love it. And thank you for putting that all together. I really appreciate it.
Always.
Yeah. So John, we're meeting with our patients, and like you just explained, people, some of them, they get started and we see the change starting. Okay. But we have, every single time we see this amazing change with people. And what is this about? How do you explain this?
Okay. So I'm going to give you a different way of thinking about this. Body shaming. Okay. Everybody in this country, right? Especially towards women, but everybody be body shaming about being overweight, everybody appearance and all this. It's like all the time. Yeah. Multiply that by 1,000-fold when it comes to your mouth, because everybody's looking at everybody at eye level. You try to make eye contact with somebody, right? And facial expressions convey emotion. They send communication non-verbally. And so when you miss out the way you express yourselves, you're making your speech narrowed, you convey less emotion accurately, and you're sending other messages unintended. And you wind up feeling more and more misunderstood by others, because it's more about you guarding your mouth than it is about effectively communicating too. It's too much to juggle all the time.
Yeah.
All the time. And to be finally realizing you don't need to guard your mouth anymore. It means that you can change other aspects of your life then too, or that you have the energy now. So somebody that starts losing weight and going out more, or getting a new job and becoming more and more alive because of the work that you're doing, it's also because you're freeing up the time that they can now apply it in other aspects of their life that they felt that they needed, instead to always focus on guarding, that somebody's not going to notice something that they're embarrassed about. And maybe it's not even just embarrassment, right? It can be humiliation. It can be believing that you're going to be misunderstood.
So is it something like this, John? Like, if, let's say, you feel shame, you feel negative about what's going on here, and that's like not having money in the bank. Just as a analogy. And then once that thing is removed, now it's you feeling good. Your bank is loaded, and you're using that. I mean, I don't know if it's something like that. It's like it's a confidence
function of communication to be able to look at somebody and give your full facial expression. So again, you just can't do it without opening your mouth. You will not be accurate. Again, and our brains process this no matter what you try to do consciously. So that's what I'm saying, is that you can try to guard it. You're thinking about guarding your mouth, but the conveying of emotion is happening unconsciously too. So instead of I'm going to consciously try to convey emotion with my mouth closed, I can't do it as well. So happiness, sadness, anger, versus with my mouth open. And especially with grimacing of teeth, you want to talk about something that's very early in our genetic programming. The human bite is actually pretty dangerous. There's lots of bacteria in our mouth. You do not want to have somebody else's skin broken by a human bite, because it really can be quite infectious. But if you're going back 20,000 years ago, right, maybe the human bite had more evolutionary significance in it. So we're conditioned to automatically experience a little bit more fear. Oh, that person's really angry. It's like, right? The teeth you automatically will go there and look at my mouth being open. And that's not just because of my sound or because of what I'm doing. It's actually genetically programmed in us to interpret what this means at us. Just like even if you have a pet snake and you love snakes, right? If you just suddenly come upon a snake, you might initially flinch, because it's hardwired into us to have that response. Mm-hmm. Now, if that's true, I'm telling you, how often are we going to be surprised by a snake? Not often. But every interaction with a human, that sort of thing is going on. And so you think that you're going to consciously guard so that people won't recognize what you're upset about and going on in your mouth. There is no way to fully cover that, because to be a fully functioning human being, we have to be able to express ourselves, and that requires a full face. And that full face requires having good dentition, or you're going to either be one of those people that accepts having bad dentition. Those people out there like that. But most of us, I think, recognize that it's not just so that we can healthy eat.
I think it's important for everybody. I mean, it's like maybe some people say they don't care about the looks, but they do care about eating. I mean, can you know a individual, like a single person?
I know one guy that was kind of a thug, and he made some money as an enforcer, and he had one tooth knocked out, and he liked that for his work. Like, he's willing to take a punch. But guess what? When he stopped doing that, the first thing he did was he got his tooth fixed, because he wanted to have his smile back.
Well, smile for sure, 100%. But, some people, it's, you got to stay alive. To stay healthy, you got to chew. And that's when also teeth come in. And like, without chewing, we're not really whole, right? I mean, so that's the other part of it.
Any dentist should say, what happens for a lot of people is they feel like the problem, now that it's manifested, it's like too late. It's already happened. And now the punishment is I'm going to have to live with what's going on in my mouth, and that I did this to myself, that I could have done something else, and now I've ruined it. And that's where I believe, like, the psychological self-dialogue is ill-informed. Please, why don't you first talk to your dentist and find out if there's any truth to that? And you might actually learn that what you're telling your head is just perpetuating the pathology, what's going wrong in your mouth. It's one of the things saying, I'm going to plan to get this dental work done. I don't have the time to, or I don't have money to. I want to plan this out. That's one thing. But if you're avoiding it because you're just telling yourself there's nothing that can be done for you, did you do that after talking with somebody? Almost every one of these people,
Great point. Great point.
they've
Yeah.
made all these assumptions about what your work is. The minute they hear from you, it takes about 5 minutes, I think, on average for them to start to feel engaged, that they can ask their questions. What's going to happen to me? And is this really possible that this can be different? And then you start to see the excitement that they didn't consider. They never thought that there could be a resolution with a positive outcome. It's not just doing the great work.
Absolutely.
It's absolutely making sure that a person psychologically can understand that there's another type of reconstructive work that's going on here. And it's in their heart.
Wow.
That they've punished themselves for this. That the crime of having a bad mouth represents like all the other failures maybe in their life. Like, I deserve this. You know something? You can tell yourself that you deserved all that bad stuff. He'll still do a great job. And you can marvel at, well, now I have a great set of teeth, but why did I have to tell myself that I deserved that then? And maybe then you wind up seeing somebody like me, if it's that bad. But to avoid this, avoid getting good care for your mouth requires, I think, a person keeping their head in the sand like an ostrich, that they literally don't want to have the facts. They're just wanting to accept that they're going to have bad dentition. So getting a message out, doing this type of work that you're doing here and asking me to participate, it's not just about shoring up business and getting more people coming. It's literally to encourage people. You come to an expert and find out what's possible. You're going to be surprised, I think. And let's demystify that.
It's really amazing the time we're living in because of so much possibilities. I mean, maybe 20, 30 years ago, these things were just not possible. But it's amazing. It just keeps us so satisfied with our work, and because there's more and more new advances that we're able to use for our patients, and it's just it's great. It's really a wonderful time to be living, and I guess you got to be living to the full,
I tell our patients, it's not enough just to survive, right? Going from victimhood to survivorhood. But how do we go from survivorhood to thriving?
Thriving, yes.
I want to see people.
I love that. Thriving, yes.
And you'll thrive when you can engage with somebody and show your face. This is simple. It's not about just, it's just not cosmetic to be able to convey your full emotions. And you can't do that if you're hiding behind a mask. The mask that we wear sometimes for our health, but I'm talking about a different mask. The mask, hi, it's really nice to meet you. The person who's doing this gets comfortable with covering themselves. The person that they're engaging with that's new, it's like, why is this person doing this? And so you won't even notice that the other persons around you don't get why you're doing that.
Yeah.
If you're really good at covering your mouth, then they won't maybe even notice that it's because you're self-conscious about what's going on in your mouth. But that then leaves a person mystified. Why is that person kind of strange around me?
So you can be easily misunderstood, right?
Very misunderstood.
By your closest family, too. I mean, it's like I have seen that, too,
Not feeling like you can smile to your children, your grandchildren. That doesn't have an impact? Of course it does.
100%, yeah.
So it's just, patients should learn to just come in and get more information first if you're afraid. There's no rush to this. Yeah, if it's taken years for this problem to be that bad, it could take a little time to help you understand what this process is. But I think you'll be surprised that it's not going to be this arduous, long thing that's just, years and years in the making, like you're stuck. And maybe some people are nervous about that. They're finally,
so they see once people are at that point of okay, I got to do something. I own my problem. It's not somebody else's problem anymore. I need to do something about this. And then they could be worried about, okay, like, how long is this going to take? Well, that's the other good news. It can be same day. It's amazing. Like, if I was told this like 20 years ago, I would say, no. It's the same day. People just walk out with it. It's a procedure. I mean, it's a surgical procedure. Of course it is. There's some discomfort involved, but we're able to do it the same day. Amazing. I mean, it's just like, wow. And who knows what else is going to be coming. But it's like, this is really fantastic for people who have this type of a problem or any problem. You know, I just.
But they shouldn't act on it.
Right, exactly. I mean, once people are ready to take this first step, then, you know, then it becomes easier because everybody's on the same page. I always tell our patients that I meet in the consults, I cannot own this problem for you. You need to own the problem first. I'm happy to help you with it, though.
I had a patient who had a full upper done, and he was avoiding his teeth. He was avoiding it. And I got him, well, why? I'm not going to spend this money until I stop smoking. I don't want to. Why would I spend it? And then I'm still smoking. I said, do you understand that you're avoiding the work, saying that it's about the smoking? Okay, how about this? I'm gonna have you go to your dentist while you're still smoking. Okay, let's accept that you haven't stopped yet. But why don't you go and find out what's possible and what we would do? So I got him to go. He was still smoking. He comes from the appointment. He goes, Dr. H, I'm going to stop smoking now. I said, why?
That's great.
He said, because I want that dental work done. I said, do you realize you were avoiding learning about this because you told yourself that you had to stop smoking first? But instead, I just said, why don't we just skip past that? Why don't you learn what's possible? And then that became the motivation for him. He wasn't going to spend this money. He wasn't going to do this if he didn't stop smoking. But he used that as the excuse to avoid the treatment that he needed. Mm-hmm. And that's what I mean by a person will tell themselves a script that's about justifying keeping nothing happening, to just not doing this problem. Yeah. And it doesn't have to be like that, right? And we're all getting only older, right? You should do it now.
Yeah, I mean, so like, there's many excuses, you know, and I understand it. You know, I understand that people are not always ready, but the biggest one is money. And yes, this is expensive treatment. Yeah. You know, it can cost a lot of money. But the last time, you know, you can check with yourself. Like, when did you, if you feel that what you're spending the money for does not really equate the value of what you're receiving, then that would leave a bad taste. I understand that. So for many people in their journey, they get to a point where, you know, maybe it's because of necessity, they have to do something about it, but they need to get to that tipping point where they see, okay, this thing is valuable. This thing really is going to, the exchange for doing this is going to improve my life in a positive way. And that's really priceless. So that's what we observe from patients. Patients, you know, they are committed, both for, you know, for psychologically and also financially. They people, we didn't expect that they would go forward with this. They found a way, and we helped them, and it happened. You know, it's just the way it works.
I think there's also this disconnect about doing, you know, this restorative work. And let's say a person didn't have a good dentition to begin with, mm-hmm. and genetics play a huge factor in this, and now they need this type of work. I think that people will have this psychological belief that you're only going to bring it up to some like average level, like it's going to cost double or extra, right? If you really make my smile perfect. But he's not going to put in the teeth. You didn't pay me that amount, so actually your teeth are going to be off center because, you know, it doesn't. No, you actually get. It's going to look amazing, and.
Well, I never thought of that.
Yeah, but people, I think that they're not going to deserve to actually have a winning smile. It's not just they get back, you know, restoration of properly aligned teeth and all, you know, functional for you. It's you've got a full set of teeth, you've got a full smile, and it's a beautiful smile. And that's more than I think a person who's living with pathology in their mouth, living with dentition that they're embarrassed about and self-conscious about. There's just no concept of, you can imagine having a full set of teeth. You're not imagining that you have a winning smile. So that's what makes it so much extra fun, I think.
Absolutely.
Doing.
100%.
Again, I mean, just
100%.
And then that's the whole point of it. This isn't just a job then for you.
No, it's not a job.
You're on a mission.
Correct. 100%.
And that's
100%.
That's what every person wants.
You know,
we want, you know, a doctor who's doctoring. Many doctors, few healers. We want to be both. So
yeah.
We're going to heal your smile, but then it heals many other things. And the validation of that in that process, and then it's a shorter process than people, you know, fear it would be, represents that they can change other things too. Because if you believe that for years and years and years you've avoided dealing with this problem, and then you believe automatically then it's going to be impossible to deal with, in other words, that it's going to take too long to repair, and then you come here and you realize that, well, that's not true. And in fact, you're getting, the patient's getting this excitement that everybody has here for that patient. That's why you guys are reporting that people are changing other aspects of their life.
Yes.
And they're sharing it with you because you've given them that. There's a lot of symbolism in our smile, and it impacts us too. So the smile that you give yourself when you're looking in the mirror as a start to your day represents then carrying forward how you're going to greet everybody in that day. And when your life means more to you, yourself like that, you're going to give more of yourself to others. And the way you socially then interact with everybody is going to start changing in ways that are going to delight you and surprise you. And it's just such an exciting, hope-filled opportunity for people. And there's too many people out there with this problem. And it's just wrong.
It's heartbreaking.
I just wish this country would get better about how we make it possible for people to have a full set of teeth. But until we get there, I'm just glad that there's people like you that talent and just good bedside manners, help a person feel good about this process. There's no reason to have embarrassment once you realize that everybody here is to support them,
100%.
Make that better for them. And they're going to leave here with a life changed.
Yeah, we see that over and every day. Every day, it's amazing.
You don't have to take an antidepressant. It doesn't have to. Psychiatry, by the way, is my specialty is dealing with diseases of exclusion. The reason a physician has to be doing this is we're constantly making sure there's no other medical explanation for the psychiatric presentation. So there's people who have anxiety and depressive disorders, not because they have an endogenous, genetic predisposition to be anxious and depressed, but maybe for some of these, I'm certain of it, it's just 100% due to the fact that they have a bad set of teeth now. Why should I get an antidepressant?
Yeah.
Let's fix the teeth and look at this. You don't need an antidepressant.
If you told me this before, 10, 15 years ago, maybe I would have said, maybe. Now, 1,000%. 1,000%. That's how much I believe it now. It's amazing. You said it so beautifully. Thank you, John. I really enjoyed this conversation. So it was really wonderful to hear all of this from you.
Thanks for having me.
Yeah. Do we have any other questions? All good? Thank you so much. I really appreciate it.
Helpful?
Keep smiling.
Oh, wow.
Wow!